Hello, we will be talking about literature reviews. Literature reviews are different than annotated bibliographies in not the articles that you've read to write it, but in what is written, how it is presented, and the purpose as well. So let's dive in. What is a literature review? A literature review covers all of the literature, and in a better word, research of your topic. So if I'd like to know about schizophrenia, the literature review would give me a full picture of what schizophrenia is, why it's of concern, what's being done about it, what has worked, what hasn't worked, what are the risk factors, and how it affects the population that we're talking about. So a literature review always includes an introduction about the topic area. It includes many, many references, and those will be in a reference sheet at the end. But throughout the literature review, it will be a full paper that discusses, that presents all of the information about this topic area, and ultimately will cite all of your references. So in talking about what the diagnosis is, obviously you will refer to the DSM. However, in talking about what is known about the issue, so in this case schizophrenia, you will then cite the people, the different researchers throughout your paper, the different researchers who have studied this and have studied what works to help the issue and to treat different populations and so forth. Ideally, your literature review is organized with an outline thematically. So the first paragraph will be your introduction, and thereafter you will have at least 3 body paragraphs which will be different kind of themes. So one might be, what does schizophrenia feel like to the individual? Another paragraph might be, what are the risk factors? And another paragraph or body component, might be multiple paragraphs within, will be talking about treatment. Ultimately, within all of these paragraphs in the body of this paper that is your literature review, you will be citing other people. It doesn't involve any opinion whatsoever. Everything you say in a literature review comes from professional researchers. Everything is cited. You never use the first person because this isn't about you whatsoever. It's only about these researchers and what they have found, what they have shown to work to make this particular issue better. Ideally, you would cover everything that's read about this issue. Now, that's not quite possible for some issues that have been studied for some time. It's quite a bit more possible if you have a more recent issue, like sex trafficking or something that hadn't been studied in prior years. Nonetheless, you are still exposing their findings, their writing, not in quotations, but in summarizing. Multiple researchers might have said the same thing. So they might say, everybody that you read might say that the risk factors are similar. So when you're talking about those risk factors, when you write it out, afterwards, you're going to cite all of the authors that wrote that same thing. And please refer to your APA manual to understand how to do that. Also, I really recommend visiting the Writing Center, not just for APA formatting, but for organizing your thoughts, for sentence structure, for making a good, strong, compelling argument of what you're writing about, but also visiting the library and finding the best articles to include in your literature review. I have other resources about literature reviews. Please visit those, and keep in mind the library and the Writing Center are your friend. And you can always ask me for advice as well.